Unused insulin vial pen should be stored in refrigerator between 2 to 8 degree of centigrade, and it should not be put in freezer. And once the insulin vial pen is opened for use, it should be kept in the room temperature. And there is a shelf life also. Normally, once insulin is brought from uh, pharmacy to home, it has a shelf life of, in general, 1 month, 4 weeks. It can vary slightly, less or more, but it has a shelf life of around 1 month to 40 days, 45 days. So this is how insulin needle. There are practical things should not be left attached. If you're just using a general insulin syringe, we must all have seen insulin syringe. It is a thin variety, and insulin needle is also very thin, thinnest type, so that because person has to take repeatedly again and again every day, many times in a day. So it has been devised that the needle is very thin so that it does not cause pain or injury or infection. And expired insulin should never be used. And this is briefly, pictures of how insulin should be taken. Skin should be cleaned with a swab and grab a fold of skin, and then it has to be uh, injected, you know, vertically 90 degree. And some people may also like to inject it in 45 degree, but better to practically inject, hold a skin fold and inject it. The insulin sites, thigh, abdomen, most commonly used, and this is how you use it. Pens, we should, as I advise you all again to purchase pens by yourself for your own practice. All types of insulin, cartridge, pens, long-acting, short-acting, and see them yourself. Try to load them, the insulin doses, and try to see how it works, and train yourself practically. Then what it is written in the books, that is important. But having handled insulin is very, very important for yourself. Even many times in our own families, we may have diabetic people, so you can see them how they are using, and how they are doing it. And we should be knowing each and everything about handling all these devices. Unless we know across all spectrum of these devices practically, we would not be very comfortable in advising patients how to do that. And these are some of the insulin delivery devices. They come in different colors. Color code is important. That is why I am saying again that you have to see them practically, because the types of insulin, the doses of insulin, you can make out from the insulin pen itself, which company, and also most important, what is the cost of the insulin. Normally, the analog insulin are very expensive, and insulin pens are also expensive, and often this is a long-term condition. So when we are writing insulin, the type of insulin we also decide for the patient. Also, we should see it should be it should be affordable for the patient. Uh, there is no use of any therapy which is not affordable by the patient. Insulin pens and injections are not normally easily available from government hospitals, dispensaries, or any free schemes. These are normally mostly available in the private purchase only. So we should be mindful of the type of insulin we write, the cost of insulin we write, and dose of insulin we write. We should be very judicious when we prescribe insulin to any person, and we should be guiding about each and every aspect of insulin management to the patient. Then only compliance would be better, outcome would be better. Knowing science is one thing, but achieving its compliance in the patients is again a challenge which we have to meet as physicians and family medicine practitioners. So these are again different types of pens, and I advise you again to check them and see them by yourself. These are the different parts of insulin pen. tip, rubber seal, insulin reservoir, dose window, dose knob, injection button, needle, needle cap, pen cap. So, how it is made, what the device is like, what are the parts of, so that you can explain if there is any question from the patient, and if there is any practical difficulty a person may face, how to, see how many doses have already been given. So you see there is a dose window, where is the injection button, unless you know from where to press in a pen. Many times we are, we confuse even with writing pens when we do not know where is the button and how to open the cap and things like that. So you can just imagine how devastating it can be for a patient if they are not counseled properly about use of the pen. And this can be also barrier in practical uses or introduction of insulin. And these are the advantages of insulin pens, because then you can advise patient, they can carry them during the travel, in the flights, for short trips, easy to adjust. Even if you explain an old person, even uneducated person, if they are mindful, they can use it by themselves. And pens do not require longer refrigeration, and that can be kept out of direct sunlight in room temperature. Disadvantages of pen are more costlier than the normal syringes, and you cannot mix different type of insulin in prescribed doses. And these are the common things like expiry date, pen needle, and uh, how to discard these insulin pens. These all come in the preview of our practice. How do we advise? How do they discard it? And when to change the the needle, and how to use insulin pens, wash hands, then mix it, remove the protective cap, and then hold skin. And then it has to be given in this particular order: one hand pen. And this is how you have to explain your patients. You can have pre-printed material where you can advise your patient that this is the way the insulin pen should be handled and used. And before that, we should know and educate ourselves how we should do it. So this again is continuation of never leave the needle on the pen when not in use, and throw the used needle into the container, screw the cap, and keep the needle container safely. So it's important that we ourselves know you know how to maintain these pens. Unless we know, we cannot tell patients.